back to the morning show. I'm still pounding coffee from Rocky Mountain Roastery right there in Fraser. It's next to Murdoch's. You ever been there?
Oh, yeah.
Yeah, I'm a frequent
Both
flyer.
places.
I tuned my bike next door at Totally Wired
Yep.
bike shop, and so I always have to get a cup of Joe from Rocky Mountain Roastery. Hanging out with Jen Fanning, we're talking healthcare, talking Grand County Rural Health. One thing to bring up, and this isn't just mental health, but seasonal depression is a pretty big thing around here. I know our ski resort offers a great thing for their employees that I think they can all get a mental health appointment or two if they're struggling. You know, it's dark, we have incredibly long winters, but you guys offer some mental health support as well.
Absolutely. So one thing to note is mental health is this huge stigma, right? That, gosh, I got to go see a therapist. 80% of us are going to need to see a therapist at some point in our lives. So it's common. It's
80%.
80%.
Whether it's the death of a loved one or God knows what.
Right. Situational depression, whatever it is, just getting through a hard time, whatever it is. So it's not some abnormal thing. So I just had to say that. So yeah, absolutely. So for example, let's take Joe, the same guy we were talking about earlier. Maybe he's now depressed because he has diabetes and heart disease, and it's winter, and he needs to get in and see a provider. So part of our PAINS program is we have vouchers to get in to see a mental health provider two times. They can go in and see them. And then in addition, we are just launching a collaborative program because mental health is a huge issue in our community, as in most communities in Colorado. A collaborative program with Grand County government, Mind Springs Health, and Middle Park Medical Center, where it's very similar to the Patient Navigator program, where we're going to have, where we do have licensed providers, mental health providers. So we have a licensed social worker and a licensed, an LPC, a licensed practicing clinician. They're going to kill me. I can't remember what that means.
No worries. We're keeping this big
licensed
top
professionals
down
who can then go in and it's called brief intervention. Like they can see you in the doctor's office. They can come see you wherever you are that's in a safe space, and they can talk to you and give you just a tiny little bit of therapy. And then say, man, it sounds like you're going to need to talk to somebody for a little bit longer.
So is it similar to the other one where they're going to get you kind of on a path to help?
Absolutely, get you to a mental health
And they understand, to kind of back to the nurse, they're going to understand, what's behind mental illness and stuff to help you kind of segue yourself into that.
Absolutely, and remove all those barriers, transportation and whatever it is, to help get you where you need to be, wherever that might be.
Oh, I mean, that's incredible. And I don't want to switch gears on you, but we're going to have to touch
real
quick. It's healthcare season. Open enrollment's upon us. If you're like me, December 15th is come and gone. And I shouldn't say if you're like me, I've registered, I'm enrolled. But December 15th is come and gone, so that doesn't mean open enrollment is over. If you don't have insurance, it's still open enrollment.
Until January 31st.
So you got to, until the end of January, you can still enroll for health insurance. So it's not a January 1st or nothing deal.
Right.
And so definitely get out there. We already talked that we have some great resources at the library. Does everyone need to sign up? Obviously, if you work for a company that provides health insurance, they have their own open enrollment.
Right, absolutely. So yeah, I mean, your choice is to sign up for health insurance or to pay the penalty. And no matter what happens, this is the single biggest question I've gotten since early November, is no matter what happens with our president-elect, when he takes office, no matter what, if he were to get rid of the Affordable Care Act day 2 in office, those health insurance companies throughout the state and throughout the country still have a legal contract that they have to fulfill through 2017. So it's not just going to happen.
Go enroll. Get your insurance. Rules may change, and next year during open enrollment, you're going to find out what those rules are, and we'll make adjustments. And
be educated and make an educated choice. Whatever that choice is, best for you and your family. Just be educated.
And I can't harp on enough, if you feel overwhelmed, feel like you're broke and you can't afford it, just go take 2 minutes, talk to whoever's hanging out at the library, or give gcruralhealth.com a call, because someone can explain it to you in much simpler terms that you might not end up paying a cent. And there's absolutely, really right now in today's world, there's no excuse to not have health insurance. There really isn't. I mean, everybody should be able to get covered right now.
It is very expensive for the people who are that 400% and above, but there are other ways, other things to do and to choose. So again, just be educated, and you can find that schedule also in the newspaper, as well as, like you said, on our website.
So open enrollment ends January 31st.
For a March 1 start date.
Anything else we want to touch on? Grand County Rural Health. Got any other thoughts you want to part ways with us? Any big fundraisers coming up that we should know about? You can always, of course, log on to the website, find out ways to donate, or some fundraisers coming up as well.
Absolutely, absolutely. We have our annual Bulls, Boots, and Barbecue. Do you think I would remember the date? It's August 17th or something like that.
Not anytime soon. So if you're here for a week, don't worry about it. Right? Yeah, exactly. I attended this year. It was pretty awesome.
It was fun. Yeah,
it was a beautiful area. Is it always at Strawberry Creek?
No, we're having it this year at Be Lazy 2.
Be Lazy 2, right in Fraser.
Here in
Sweet.
Fraser.
I can get home a lot
really
easier.
excited.
I can ride my bike there, you know.
Yeah, we're also really working on making sure the voice of the voiceless in our community is heard, and making sure that we're able to just make the system work for everybody.
All right, Jen, before we send you out, we got to give you a little this or that questionnaire. So I'm just going to test your brain.
You're
Quick
terrifying
answers.
Me.
You should be.
This is mental health test 101.
I'm going to fail.
All right, we're just going to get right into it here. You ready? All right, NSYNC or Backstreet Boys? Come on, Jen.
New Kids on the Block.
NKBK, whatever they're called. All right, Monopoly or Life?
Monopoly.
Okay. We got corduroy or powder?
Oh, powder.
You say you
I'm
downhill
like,
ski.
Powder.
Pow.
I was
Bring
thinking
out
pants.
money or respect?
Respect.
All right, summer or winter in Winter Park?
That is a tough one. I like summer. I like them both, but summer is just so special.
Great answer. Summer's magical, but winters are magical too, so it
It's
is
all
a tough decision.
magical.
I've actually come to like mud season because I like a little nap time.
A little break.
Yeah, we didn't really get one this year, and I'm still hurting. I need my naps caught up. But Jen, thanks so much for being on the show.
Yeah, thanks for having me.
Yeah,
It's
we'll look
always
forward
fun.
we'll look forward to having you on again, and we'll look for you at Boots Barbecue and
Bulls, Boots, and Barbecue.
Bulls, Boots, and Barbecue at Be Lazy 2 this coming August.
Yes. Yay.
All right. On that note, we're going to duck off, but definitely open enrollment ends January 31st. Check these guys out at gcruralhealth.com. They are a must if you have any confusion or any questions about your health. There's no excuse in today's modern world to not be healthy. On that, we're going to take a break, and we'll be back in a little bit.
You guys keep talking amongst yourselves.